There's a new procedure that is giving people here on the Gulf Coast a little more heart and a lot less worry. It allows doctors to repair a valve inside your heart without the stress or risk that normally would come with major surgery. We are joined today by Dr. Daniel O'Hare from Lee Health's Heart Institute with more on this exciting new tech. Thank you for being here, Dr. O'Hare. We appreciate it.
Yeah, thanks, Jen. Happy to be here.
I'm really happy to hear about this coming to our community. Can you, in layman's terms, in my terms, can you explain what this is and how it's different from what we've done in the past?
Sure. Well, most people, when they think about heart surgery, they think about the sternal split or the incision down the middle of the chest where the bone is cut with a saw.
Right.
And that's the way that most operations are still done today. But what we're especially excited about is the offering of robotic-assisted heart surgery, which avoids any bone cutting whatsoever.
Wow.
And really, it's done from the side.
Okay.
And it really is a step up and even an advancement over what's been called minimally invasive surgery.
Right.
Because really what troubles patients, it's either the bone cutting or rib spreading. You know, people know what those are, rib spreaders and bone cutting. But this avoids all of that, and we put the instruments in through small 7-millimeter punctures in the chest wall, and it allows us to do the entire operation without spreading the ribs and without cutting any bones.
That's amazing. Is it only for, nothing's minor, but minor heart ailments, or can you do massive surgeries?
Yeah, this is for, well, primarily what we're focused on is heart valve disease.
Okay.
Specifically mitral valve repair, mitral valve replacement, some other procedures that are related to that. But yes, it has really been a huge step forward for the patients, accelerating their recovery, shortening hospital time, reducing complications, and getting people back to work faster.
It's truly remarkable. I would think it would cut down significantly on that recovery process, which so many of us are afraid of when you go in for a major surgery like that.
Sure, one common measure is, how long do you have to be in the hospital for something like this? And after the sternal incision, the midline chest incision for this kind of work, typically patients are in the hospital 5, 6, maybe even 7 days. When we use the Da Vinci robotic approach, we have patients who go home typically in 2 days.
Wow.
And interestingly, we've had a few patients go home 1 day after heart surgery. So it is a huge step forward.
That's incredible. We've heard of the Da Vinci being used in other types of procedures, but this is new, this particular heart procedure for the Gulf Coast.
It is, and I'm very proud to be at Lee Health and to be part of bringing this forward. It is we are the first in Southwest Florida to offer robotic-assisted mitral valve repair and replacement. And people are noticing. We're getting a lot of attention, and it's going quite well. So we're very pleased with how things are going.
It's incredible. How do you know if you're an ideal candidate? Obviously, you meet with your cardiologist, but I would assume that there might be better candidates than others.
Sure. Well, particularly we're focused on mitral valve disease. So, patients who have, the way this typically gets started is someone has a murmur, heart murmur, and that leads to an echocardiogram, and then the diagnosis and subsequent treatment. But there are a subset of patients who don't really feel the symptoms, and that's why it's important to stay in touch with your doctor, especially if you have a murmur. Others are experiencing shortness of breath and fatigue, which is reversible when it's caught early and treated properly. So we're happy to get involved early in the care because it always leads to better results.
It is truly remarkable. How can our viewers get in touch or learn more from the Lee Heart Institute?
Well, leehealth.org.
That's a good spot to start, right?
Yeah, leehealth.org, robotic-assisted mitral valve surgery.
All right, you can see that we are working with Lee Health this month. It is Heart Healthy Month after all, February. We are focusing on making sure that we maintain and promote heart health. Thank you so much for being here, Dr. O'Hare. We appreciate it. We're going to put a link to Lee Health and Lee Heart Institute on our webpage as well as our Gulf Coast News app. We appreciate all you do, and we're so excited to have it here on the Gulf Coast.
Thanks, Jen. Yeah, thank you.